Since you've scheduled your facelift, we're going to talk about your postoperative care. Your first night will be here at our plastic surgery center. Krista will ask you what you want to eat and drink for that night. There'll be two nurses who are going to be paying attention to you throughout the evening. They're going to change your drains. They're going to provide you with pain relief. You'll be hooked up to an IV. They'll give you anti-nausea medicine. Most importantly, they'll be using cool compresses on your face to help keep the swelling and bruising to a minimum. You will be elevated about 35 degrees. You will be able to talk to your significant other via your cell phone, so if you want to bring your cell phone, you can either FaceTime or just talk to them during the evening. They unfortunately will not be allowed to spend the night here. The following morning, you will be awake and alert. The catheter will be removed from your bladder and you'll get dressed, and at 6 a.m. your ride will come and get postoperative instructions so that you'll be all ready for home. Now you may want to buy some of these things before you get home because it's valuable to have a few bags of either frozen peas or corn, or you can get the little gel things that look like peas in a bag. You're going to have one in the freezer and one that's available for your use. So at home, when you get there, you'll be wearing your TED stockings. You'll be in some very comfortable clothing. You'll want the head of the bed either to be raised to about 30 or 35 degrees, or get a wedge or some pillows that are going to prop you up. Some people like to recline in a recliner, which is a great thing too, and you can sleep in it, but when people can just lean it back and you can sleep and then raise it up and you can get up and walk around. Your first day at home, you're going to be spending a fair amount of time in bed or in the recliner. It is important you get up and walk around to go to the bathroom, to sit up and eat, to keep the blood flow through your legs to reduce your risk of clots. During that period of time, you're going to be keeping cool compresses on your face to help keep the swelling down. You're going to change those. They don't have to be on all the time, but you're going to do them for 20 minutes every hour or two. You'll notice the swelling increase. The more you keep the cool compresses on, the better it'll be. If you had your eyes and brows done, your eyes may be open, and you'll be using lubricant that will give you to protect your eyes while they're open. And if you want to watch TV or read, you'll have liquid tears to wash out the ointment and to keep your eyes protected. You'll have drains. They get changed every 2 to 4 hours. It's a test tube on, a test tube off. And you're going to come in the following morning on your second postoperative day, at which time we're going to remove those drains. We're going to start removing some of your eyelid sutures. You'll then be able to take a shower when you get home. Each day, first day, you're going to want to stay with soft foods, not spicy, not greasy, a lot of liquids. You're going to start your antibiotics after you're able to eat. If you get really nauseated, you can call us for some anti-nausea medicine, but the first thing you might want to do is either cut back on your pain pills or stop your antibiotics. You will already have enough antibiotics. We give you a little bit extra, maybe overkill, to help prevent infections, although infections are very rare in facelifts. You can get up and walk around. You can lift up to 25 pounds for the first 2 weeks. You want to avoid a lot of talking. You want to avoid getting upset or emotional. So you just want to take it easy and just chill for the first few days. After you leave our office on the second day, your early sutures will be taken out and your drains. You'll be able to get up and get around more, walk around. You can cook, but you can't carry the groceries. You can do the wash, can't carry the laundry. Nothing more than 25 pounds. By day 5, and I will tell you, you'll like the way you look at day 2, and then day 3 through 5, you're going to swell up more, and then by day 5 and 6, it's going to come down. Day 5, you're going to come in, we're going to take out your preauricular sutures, we're going to take out the rest of your eyelid sutures. Usually by day 6, you'll be able to go shopping with sunglasses on. Mentally, you'll be with it after the first 2 or 3 days. You'll be able to talk to people on the phone coherently. Usually by day 10, enough of the swelling and bruising is gone that with some makeup on, you'll be able to go out to dinner with your significant other. And by 2 weeks, now day 9 through 14, somewhere in there, we're going to take out your staples and your post-auricular sutures. But usually by 2 weeks, you can go to a cocktail party with makeup on it and you'll look better than you did before surgery. If there are any specific problems that you have during this time, call the office. Betsy, Terry, Krista, they'll all be able to answer your questions. Anything they can answer, they'll come get me and we'll talk to you. So know that we'll be there and available at any time to answer your questions. All right? Hope you're prepared. And remember, everyone gets a little emotional day 3 through 5. You automatically, as you swell more, you get depressed and say, why the heck did I do this? You're more swollen, you're achy. But by day 5 and 6, you're going to know why. And by day 10 and 2 weeks, you're going to love it. Okay? Look forward to helping you.